So as we start all of our classes, we want to make sure that you know all of your resources that you have available at Bronson. At bronsonhealth.com, you can search for a doctor or a specialist that is available taking new patients in your area. And if you don't go to the bronsonhealth.com website often, you can always call the number listed on the screen and speak with one of our care advisors to get that assistance. Bronson Health Answers is also available at Bronson with the phone number and email addresses listed on your screen. If you ever need any help with MyChart, MyChart is that electronic medical record where you can access your own labs and test results. But if you ever need any help with that, Bronson Health Answers is the department to ask those questions to. Bronson Patient Accounting is available if you ever have any billing or payment plan needs. And then we also have a price estimator team that can estimate your out-of-pocket expenses for any services that you have been referred to at Bronson. And so you can call that phone number, or you can also use the estimator tool within the MyChart. And you do not have to have an active MyChart in order to utilize that service. Sally's going to take it away for us.
All right, thank you, Tina, so much. So what we are going to be talking about today is the open enrollment period for the federally facilitated marketplace. So some of the things that you're going to learn are beginning dates and end dates, and for what qualifies for a special enrollment period, what insurance Bronson Healthcare Group participates with in the marketplace. We have 4 insurances. Thank you. In the marketplace, there's also a premium tax credit and a cost share reduction, and what that will mean to you. And 4 things that will help you decide which insurance plan is best for you and your family. There are several places that you can go for assistance in the marketplace to enroll. You can go directly to healthcare.gov, create an account. You could call the federally facilitated marketplace at the 800-318-2596 number. Or if you would like to have somebody live and in person trying to explain things to you, that would be me, Sally Wilkins, at 269-341-8355.
We want to hear from you guys. Has there ever been a time where you felt frustrated or overwhelmed by making decisions about your health or medical insurance? Go ahead and type your answer in the chat, or if you feel comfortable, go ahead and unmute yourself and share your answer. Has there ever been a time where you felt frustrated or overwhelmed by making decisions about your health or medical insurance? So in the chat, we're getting yes, always. Yes. I know personally, yes, it is hard to know, right? And help predict the future. Like, how do I know I'm making the right decision? That's a hard call. All right, very good. We've got a sometimes in the chat as well. Thank you guys so much for participating.
Okay, so open enrollment in a federally facilitated marketplace for 2024 actually begins November 1st, 2023, and it ends January 15th, 2024. During open enrollment, if you enroll between November 1st and December 15th of 2023, your insurance would begin January 1st of 2024. If you enroll December 16th through January 15th of 2024, then your insurance would begin on February 1st of 2024. So for special enrollment, that's enrolling outside of the open enrollment period, which again is November 1st through January 15th of 2024. So special enrollment means that there's been a change in your household, such as marriage or divorce or legally separated. You having a baby, adopting a child, or foster care. death that causes you to lose your health plan, changes in residence. So that would be such as if you lived in Indiana and moved to Michigan, you would want to re-enroll or go to the marketplace to let them know that you've moved. And that's really just to ensure that you have insurance that is participating in the area that you live. And then just the loss of healthcare insurance. And that an example of that is most of us don't know if we're going to lose our job. So some of us do. But if you lose your job, you have 60 days before or after to enroll in the marketplace, or during we have the public health emergency, which ended. And so a lot of individuals who have Medicaid are no longer, they're not re-enrolling you automatically. So some people are losing their Medicaid insurance, maybe because they make too much money now, but they don't make enough money to, be able to pay for the premium for your insurance. And so that's what we're here for, is to kind of help stop that from happening so that you do continue on with your insurance. So the 4 insurance companies that Bronson participates with are Priority Health, specifically in the marketplace, Priority Health, United Healthcare, Blue Cross Blue Shield of Michigan, and Blue Care Network. And what a network means is that it's a list of providers and hospitals that generally must be used to get coverage and lower out-of-pocket costs.
So Sally, before we ask this question here, there was also a comment from the previous question that the challenges there and the frustration is what the plan actually covers and looking at deductibles too. So we appreciate that comment because we are going to cover that. All right, so our next question for you guys, again, type your answer in the chat or unmute and share. Have you ever used the federally facilitated marketplace before? We've got a no, we've got a yes, we've got a no. Say if anybody else, no. I know I've tried to navigate it before in the past. We've got another no, we've got a yes. All right, looks like a mixed crowd, Sally.
That's good. Yeah. That's excellent.
All right.
So there are some terms with insurance that can be really confusing, and what I'm going to try to do is help it not be so confusing. And if you have, again, any questions as we're talking, please do put it in the chat. So what a premium means is that is the amount of money that you pay on a monthly basis simply to have insurance, just insurance coverage. That's it. So whether you use your insurance or you don't, there's an amount you pay every month to have that insurance. And then there's a thing called a deductible, and that is the amount of money that you owe during coverage period. Usually that's 1 year. So let's say January 1st to December 31st for covered health services before your plan begins to pay. So say that you have an MRI, CT, I'll go with those 2 big ones. Let's say that the allowed amount is $1,000. And you have $1,000 deductible. That means that you're going to pay that $1,000 deductible before insurance is going to start to pay for your services. So your co-insurance, that's a percentage that you pay after your deductible has been met. Let's say that you have it, and I don't want to be confusing, but let's say that they would call it like 80-20 plan. 80% of insurance is paid by your insurance company. I'm sorry, 80% of the bill is paid by your insurance company. 20% is owed by you. So after you've met your deductible, then you would pay 20% of the allowed amount for the services that you receive. So again, we'll give an example of a lab. let's say that an allowed amount was $100 for some lab that you had done. You'd already met your deductible. Then you would owe $20, the insurance company would pay $80. And then a copayment is a fixed amount. So when you go to see your provider, for example, you pay a flat rate of $20 to go see your provider. And it is usually for office visit copayments. Oh, so in the marketplace and only in the marketplace, there's an item called premium tax credit. And what that does is it helps lower your premium. That's the amount that you pay every month to have insurance for you and your family, just for the health. And your family pays the health insurance through the marketplace. You can get this help if you get health insurance through the marketplace and your income is below a certain level. And we are going to talk about that in just a moment, what those levels are. And then what the government does is they pay an advanced premium tax credit to the insurance company to help lower your deductible or your premium. So that means that if the premium is X amount of dollars, the government's going to pay the part of that directly to the insurance company, and then you're still going to pay a monthly premium, hopefully at a lower rate, for your insurance. Okay, so the marketplace determines the marketplace goes by the federal poverty level. This is 2023's federal poverty level. If you are at 100% to 138%, I know it says 133%, there was an expansion with Medicaid. The marketplace is going to automatically send you to the state of Michigan to see if you qualify for Medicaid. So from 139% to 400%, you will qualify for a premium tax credit and for marketplace coverage. So also in the marketplace, there are different metal levels. And I really like that picture too. Thank you. There's a bronze metal level, which means it's a lower monthly premium. So what you pay every month to have insurance, but it is going to have a higher deductible. And the deductible again is what you pay before insurance will pay on an approved service. The silver metal level, the premiums are medium, and it's medium to high level deductibles. And there are different percentages as well for what the insurance is going to pay and then what you're going to pay. So bronze levels are 60-40. So 60% insurance pays, 40% you pay after deductible has been met. And then on each one of them, we have an example of if the allowed charge is $100 on the bronze level, insurance pays $60, you pay $40. The silver metal level is a 70-30 plan. Insurance pays $70, you pay $30. And then there's gold and there are platinum. I will say most everybody that I've worked with chooses either the bronze or the silver medal level. And the silver medal level is a very important level because that's where you can also get this item called a cost share reduction as well as the premium tax credit.
So before we go there, Sally, and I apologize that the slides keep moving forward. I'm not sure what's going on here, but we've got a couple of questions, and I'm going to ask those to you now, just in case you feel it's appropriate to answer them at this point, or if we should wait to the end. So the first question that we've got in the chat is, how does the marketplace ask you to report income level? And how would a recent retiree come up with that figure?
That's a really good question, actually. So if you're a new retiree, what the marketplace wants from you is an estimated amount of income for, let's say, 2024. So it's going to be taking, if you have a retirement fund, if you have any income from another job, they're asking for an estimated amount of what you think you're going to make in the year. And if you are off on that, or let's say your income is higher than what you reported to them, or it's lower, you want to go back in and sign into your marketplace account, and you want to let them know that your income is different. So really they're estimating on how much you anticipate making. So again, you're going to be taking your retirement, or well, it's really your retirement if you have a 401k, and how much you think you're going to be taking out of that on a yearly basis. I hope that makes sense. And if it doesn't, I'm happy to talk to you further about it.
And then while you were speaking on the different metal levels, there was a question that says, are there out-of-pocket maximums?
There are actually, all of them have an out-of-pocket maximum. A lot of the bronze and silver metal levels, your out-of-pocket maximum is very close to your deductible. Sometimes it's a little bit higher, but yes, there definitely is an out-of-pocket max on every one of those levels.
Very good. Thank you, Sally.
Sure.
All right. So, poll question. Sally just went over the different metal levels and coverages. So, just a little quiz question, essentially. What metal level qualifies for the tax credit, the premium tax credit that we were just talking about? Is it bronze, silver, gold, or platinum? Which metal level qualifies for the tax credit? Oh, we've got a group that's paying attention. Majority of the group has voted, and they're all voting silver. Is that right, Sally?
Well,
Yay.
yes. So all of those levels do get a premium tax credit, but what's important is the silver level gets a cost share reduction. The abbreviation is CSR. So you guys are all paying attention. That's awesome. All levels get a premium tax credit. The silver level is the special level that gets a cost share reduction also.
Very good.
Okay, so look at that. What is a cost share reduction? Generally, with a cost share reduction, it's going to lower your deductible. It's going to lower your co-payment for your co-insurance, and it's going to lower your out-of-pocket maximum. Insurance must be purchased through the federally facilitated marketplace, and it must be a silver plan to get the cost share reduction applied. So again, with the silver level, it's a 70-30 plan, which 70% is paid by your insurance, 30% is paid by you. So again, an example is if an allowed amount is $100, insurance is going to pay 70, you're going to pay 30. However, if you have cost share reduction, that $30 may get lowered to even $15. So consumers who qualify for the premium tax credit may also qualify for the cost share reduction. Cost share reductions are payments that are made directly to the insurance company for eligible consumers. Again, that is made by the federally facilitated marketplace directly to the insurance. So then when you get a bill, all of that cost share reduction and premium tax credit has been taken care of behind the scenes. And when you get that bill, then that should have lowered your amount that you owe. And to qualify for a cost share reduction, the consumer must meet eligibility criteria for the advanced premium tax credit. The household income is between 139% and 150%, and that's estimate. And then you must enroll in a silver plan in the marketplace for the cost share reduction. So an example, these are estimated amounts. Income level between $27,410.80 and $78,880. for this household of two, would receive a premium tax credit. Income levels between $27,410 and $44,580. You can also qualify for cost share reduction. And the amount of the premium tax credit and CSR cost share reduction that is determined by the federally facilitated marketplace. And again, these are estimated dollar amounts. And thank you, Tina, for bringing that slide up again. It's based on the federal poverty guidelines.
All right. So another question for you, when you guys are trying to decide which insurance plan to choose, what are the most important factors for you? Go ahead and type your answer in the chat or unmute. When you're trying to make a decision on your insurance plan, what's the most important factors? So far in the chat, we've got cost and coverage provided. We do have another question, maybe while other people are answering, another question that says, do those tax credits need to be reported on your personal income tax?
That's a really good question. No, the answer is no, but there is a form that will be sent to you, and you have to reconcile the premium tax credit at tax time, but it's different than your personal taxes. So that's why it's important that if your income is higher or lower than your estimated amount, and when you sign up, that you're reporting that. You're trying to get to like a zero amount. They're giving you so much money, and that's going towards the insurance company, and they're kind of they need to like zero out, but it's not part of your actual income tax. It's just a separate form that you have to reconcile when you do file the taxes.
Very good. Thanks, Sally. And then other factors people are chatting about are low deductible and low co-insurance, cost and coverage, a balance between what's covered, the premium and the deductibles. And then another person is mentioning, the overall cost and what is covered for the prescription drugs as well. Makes sense. All right. Very good.
All right, choosing insurance that covers your provider that you use, the hospital that you go to, and prescriptions. So there are filters on the marketplace to be able to add your provider, your hospital, your prescription drug coverage, so that you're making certain that your doctor, hospital, and prescription drugs are covered. So this is what the screen looks like. And we are going to change screens now, and I'm going to walk you over to the marketplace so that you can see what it looks like live and in person.
So thank you guys so much for asking great questions and participating. Sally is taking us over to healthcare.gov so we can actually see what it looks like.
Okay. So when we go to healthcare.gov, I went to see plans. There, I have it bookmarked. So Tina, I know you've given the healthcare.gov website. You will be able to find see plans and prices. So the first thing that I do, I'm going to use just 49007. That's our zip code downtown here. And then you're going to put 49007 and click Kalamazoo County and click continue. I'm not going to give any information. We're just going to see full priced plans. And I'm going to add filters. Again, Bronson participates with the 4 insurance companies: Priority Health, United Healthcare, Blue Cross Blue Shield of Michigan, and Blue Care Network. So when I'm working with you, one of the things that I do is I narrow it down to one of those 4. Otherwise you're looking at all of these insurances and we don't participate with all of them. So I'm going to pick Priority Health. I'm going to apply my filter. I'm going to add another filter, and I'm going to add my provider. And we're just going to add Bronson Methodist hospital acute care, so general acute. And I'm going to pick the general acute hospital. And one more filter I'm going to add is I'm going to add prescriptions. So metformin is kind of a popular medication that some of us take. And so I'm going to add both an oral solution and an oral tablet because we want you to see what it looks like when we're looking at when something is accepted or is not accepted. So we've narrowed it down to just Priority Health. Oh, what did I do? All right, let me add metformin one more thing. Okay. Oh, I look at those. Oh my goodness. Okay, so you can see when we scroll through this, this is showing us the lowest premium with the highest, so the lowest premium with the highest deductible. You can see where Bronson Methodist Hospital has a green check mark. That means we're in network with this insurance. So I picked an oral metformin, I picked a real high dose metformin, and then I picked a like regular dose metformin. So you can see if your insurance will or will not pay for the medication. You can see if your provider is in network. All of the plans we're looking at are medical only. There is a way to go to dental plans and get a separate dental plan. But when we first are working on this, what we're trying to narrow down is what are you comfortable with a monthly amount you have to pay for your insurance, as well as what is the deductible, and does the deductible have to be taken care of or paid before you even get your prescriptions. So I sit with people for literally for hours, and that's what I like to do because I want everybody to have a really good understanding of what their choices are. I'm going to go back to filters real quick. So let's say that you only want the highest deductible that you want is $5,000. So 0 to 5,000, and you will see it will change what we just were looking at. So it was showing me $9,100 for deductible. It did have a lower premium. You indicated, let's show me something with not such a high deductible. Your premium does go up, but your deductible did come down. The hospital is still in network, and the lower dose metformin is a prescription that will be paid for by your insurance. Enough?
Yes, we have one question right now that I think could be a really good question for this moment, and that is, do prescriptions and medical services count toward the deductible and max out of pocket?
Sometimes. So it is actually a really good question. When I'm working with people, for me personally, I couldn't have my prescriptions fully out of pocket. So with my insurance, I choose to pay a higher premium and get my medications for whether it's $5 or $25. Some of the plans, and I'm going to go to plan detail. I'm going to scroll down. Give me just a second here. So in this case, you have a $5 copay. If you so for a generic drug and a preferred brand drug, so let's say Motrin and ibuprofen. Motrin is your generic. No, ibuprofen is the generic. Motrin is what's the word I'm looking for? the brand name that we know. So in this case, it's saying your deductible does have to be met first, right here. And then it's $75 copay. So it depends on what the wording is right in this area. Some of the insurance is part with going toward the deductible. Some of them are just a flat copay. So that is a really a good question. And I will search high and low to try to make sure that it's a flat copay. If that is what you're looking for, that is what we're going to look for. Some people are okay with having to pay the deductible first. Again, I'm not in that position, but I'm comfortable with that. So I we sit and we really try to narrow down what is the best option for you.
Thank you, Sally. And another question. So in regards to the marketplace, does the marketplace offer plans that can cover multiple states? Like if you're in Michigan during the summer, but then in another state during the winter time?
That is a really good question. Yes and no. So we're going to just check out the Priority Health, and I'm going to show you where you can see that when we go to plans. And then it's access to doctors and hospitals. Some of these will say yes. So National Provider Network means you can go out of state. I know that United Healthcare, the Blue Cross Blue Shield, Blue Care Network, some of those are a yes. You still have to find out if the area that you're going to accepts this insurance is in network. So every hospital does their own, what's the word I'm looking for? Like the policy that they have, the contract that they have with the insurance. So you're looking to see if this says yes, and then you want to make sure that the provider or hospital you're going to, say you're in Florida, you want to see if they also participate with the marketplace insurance. So it's kind of a yes and no. So in this insurance, with this insurance, Priority Health, no, you have to stay in network. So usually in Michigan.
Thank you. We have another question, but I'm going to ask that during the end. That's all the questions on the marketplace.
Okay. Okay.
All right, so we are going to go back and finish up our PowerPoint presentation. And so give me just a second. All right, so we just covered all of the filters on healthcare.gov, how we can search based upon the insurance companies that we prefer to have, how to add medical providers, and how to add prescription medications. There we go.
Okay. So once you choose your insurance company, what you can expect to receive from the insurance company, your insurance cards. They will send them to you by mail, a brochure that explains the policy benefits. So you can look at the policy benefits online, but they're also going to send you a pamphlet or a booklet so that you have that also. And then the phone number to contact customer service for insurance questions that you may have. You can also contact Price Estimates here at Bronson to find out an estimated cost of a service. And that's the 269-341-6166 number, or you can go to my chart as well to try to get a price estimate of what something is going to cost. Once you choose your insurance, what else you can expect? Well, this is part of the price estimate, so I apologize for that. You can go into my chart, you can put in the test that you're having done will be in there, and you do a price estimate back. Do you have to pay your deductible and co-payment for health benefits? Yes, generally you do. All marketplace plans have a deductible, co-payment, and other out-of-pocket costs that apply to most covered services. There are some preventive services that are free. And Tina is going to put links into the chat. There are a lot of free services for adults, women, and children for screening, such as, you know, your annual preventative that you need to have every year, or your pelvic breast. And then for children also, when children, you know, go to the doctor a lot the first 2 years of life, they get a lot of vaccines, and those are screening benefits. So again, there are more than just 3 places that you go for enrollment. I have found in the last month that there are a lot of agents who are calling people to help them. You can use those agents if you want to. You can go to healthcare.gov. You can call the marketplace at 800-318-2596. And I am also more than happy to sit with you and help you make more sense of what all of this means, because again, I know it's confusing. I've done this. I've worked with insurance for about 30 plus years. And so I have a pretty good understanding. And if I am not speaking in a way that you're understanding, then I'm going to go back and we're going to talk about it some more. Sometimes you just have to hear things a different way, and I will say it a different way so that we get a good understanding of how much your insurance is going to cost you monthly as well as yearly. All right, so I'm hoping what we learned when special enrollment begins and ends, or I mean, when open enrollment begins and ends, again, that's November 1st through January 15th. 2024, and what qualifies for special enrollment, what insurances Bronson Healthcare Group participates within the marketplace, and I'm going to say those again: Priority Health, Blue Care Network, Blue Cross Blue Shield of Michigan, and United Healthcare. What a premium tax credit is and what a cost share reduction means to you, and the 4 things that can help you decide which insurance plan is best for you and your family. Thank you.
Thank you guys so much. We are going to stop the recording now. It is 9